Welcome back to The Explainer. So today, we're cracking open the hood, so to speak, on a group of personality patterns that, well, they often get misunderstood, right? People just label them as odd and move on. But we're going to go deeper. We're going to explore these really persistent ways of thinking and behaving that experts group together as Cluster A personality disorders. All right, so here's our game plan. We're going to start big picture, with the whole personality framework. Then we'll zoom right into the star of our show today, Cluster A. After that, we'll get into the nitty-gritty of each disorder and wrap things up by talking about what can actually be done, the pathways to understanding. Okay, first things first, let's lay down the foundation. What exactly is a personality disorder? And how do experts even begin to organize these really complex patterns of behavior? So the really crucial thing to get here is this. We are not just talking about someone being a little quirky or having a few odd habits. No way. This is about a deep-rooted, inflexible pattern. It's something that consistently shows up, it's stable over time, and most importantly, it causes real, significant problems and distress in a person's life. And here's where things get organized. Experts have grouped these disorders into three main categories, or clusters, based on what they have in common. You got Cluster B, that's the dramatic and emotional group. Then there's Cluster C, which is all about being anxious or insecure. But for us, today, our focus is right here on Cluster A. This is the one they call the odd or eccentric group. All right, let's put Cluster A under the microscope. We know it's the odd and eccentric group, but what does that actually mean? What are the common threads that tie these different disorders together? Okay, so it really boils down to three big themes. And what you have to remember is that these aren't just separate symptoms floating around. They're all connected. First, you have this deep, pervasive suspicion of other people. Then, there's a real sense of detachment, a preference for being alone in your own world. And finally, you get these unusual, odd ways of thinking. And these three themes are what you'll see play out in the three specific disorders in this cluster: paranoid, schizoid, and schizotypal. So let's kick things off with the first one, paranoid personality disorder. As the name suggests, this one is all about a deep, unshakable distrust and suspicion of, well, pretty much everyone. Just think about that for a second. Imagine living your life with that as your default setting. It paints a pretty stark picture, doesn't it? A world where you believe everyone is out to get you, where making a genuine connection, or even just feeling safe seems completely out of reach. And just to be clear, we are way past just being a little cautious or cynical here. This is a whole different level. It's a fundamental worldview, where an innocent remark from a coworker is seen as a hidden threat, where you're constantly second-guessing the loyalty of your closest friends. You're always on guard, always waiting for the other shoe to drop. You can probably imagine how incredibly hard that makes it to build, and even harder to maintain, any kind of relationship. So that really begs the question, right? What is it actually like to go through life this way? Well, this constant state of high alert, of suspicion, it almost inevitably leads to social isolation. It can seriously impact your job, your family, everything, because you're navigating a world that, to you, feels fundamentally hostile and unsafe. Okay, moving on to the other two disorders in Cluster A, schizoid and schizotypal. Now, these also involve a kind of social withdrawal, but the why behind it, well, that's where things get really different from what we just saw with paranoid personality disorder. And this side-by-side really nails the difference. With schizoid personality disorder, the core thing is a profound lack of interest in other people. It's not that they're scared of socializing, they just don't really want to. They genuinely prefer being alone. Now, schizotypal is a completely different story. Here, there is a lot of social anxiety, a real discomfort, but it's often driven by these eccentric behaviors and peculiar beliefs, things like magical thinking or having strange sensory experiences. All of that makes trying to connect with other people feel incredibly awkward and alien. So, okay, we've identified these really rigid patterns. What now? What can actually be done? Let's take a look at the main approaches for treatment. And it's super important to know that even though this can be a really long road, there are effective ways to help. And this right here is maybe the most important takeaway of all. The goal of therapy isn't to perform some kind of personality transplant. It's not about trying to erase who someone is. It's all about increasing flexibility. It's about helping them build better coping skills, reducing the distress their symptoms cause, and just making it easier to connect with others and navigate the world. So, the go to treatment is almost always some form of therapy. But with cluster A disorders, you can't even get started without first tackling the huge hurdle of building trust. That's step one, and it can be a slow, painstaking process. Once that foundation is there, a therapist can start using powerful tools like psychotherapy or cognitive behavioral therapy to help a person see and maybe even challenge some of those distorted thought patterns. The real key here is a gentle approach, creating a safe, consistent space and guiding them toward reality without ever getting into a direct fight over their beliefs. And that really leaves us with a big question to chew on, doesn't it? When we look at all this, it really challenges us to think about where we draw that line between someone just being eccentric and someone who is truly struggling with an illness. It pushes us to look past the label and recognize the very real pain that can be hiding behind behaviors that are easy to just write off as weird. And I think ultimately, it's a powerful reminder that empathy is the bridge that helps us see the human being behind the diagnosis.